Hello there, my name is Dr. Linus. I live in Uganda. If you're visiting this channel for your very first time, please subscribe now because I have a lot in stock for you. Today I want to talk about how to become a pharmacist here in Uganda. First of all, in Uganda, a pharmacist is that person that has attained a bachelor's degree in pharmacy from an accredited pharmacy teaching school. This person has to be adopted by the Pharmaceutical Society of Uganda and later on registered by the Pharmacy Board of the Ministry of Health of Uganda. I'll break it down for you. Now, to be admitted in any pharmacy teaching school, especially here in Uganda, you must have done these two essential subjects, and that is biology and chemistry. Now, in addition to biology and chemistry, you must have done either physics or math. So, the two possible combinations are biology, chemistry, math, or physics, chemistry, biology. Now, in my time when I sat high school, when I sat A-level, I did all those four subjects: physics, chemistry, biology, and mathematics. They have made it a bit more easier by reducing the combination subjects from 4 to 3. Now, when you pass and get the minimum cut-off points, you must then be admitted in any pharmacy teaching school in this country. But these cut-off points usually depend on two things. Cut-off points depend on, number one, the general performance of students in that given year. If the performance is such that all students performed excellently, all students passed, expect that the cut-off points are going to be high. Number two, if so many students apply for that given course, then expect that the cut-off points must also be high because these pharmacy teaching schools have their limited capacity. They can't take more than they can accommodate. So they will only take the maximum number they can take, and the last person forms the cut-off point. So it means you have to perform very highly and also apply for that course to qualify. The reason why the cut-off points for pharmacy is always high is simply because many people apply for pharmacy and yet they can only take a limited number. And so that's why the cut-off points are always high. Now, when you get admitted into the pharmacy school, you must then be willing to study 4 years, especially here in Uganda. 4 years here in Uganda. Okay? But upon completion of the pharmacy course, the degree in pharmacy, and the university has released you, you don't immediately become a pharmacist. The examination committee of the Pharmaceutical Society of Uganda will set an exam that people have to pass before they start internship. So you apply to be among those that will sit the exam, and upon passing, the committee will submit the list of those people that passed the exam to the National Internship Committee of this country. And so it is now the duty of the National Internship Committee of placing in the different hospitals all over this country. And you have to be there for 12 months doing internship. If internship started in October, it has to end in October of the following year. Now, when you finish internship, what happens? You again have to apply to the Pharmaceutical Society of Uganda to sit another paper called the pre-registration exam. When you pass that exam, then you get adopted by the Pharmaceutical Society of Uganda. And upon adoption, the Pharmaceutical Society of Uganda will then submit the names of all those that passed the exam to the Pharmacy Board of the Ministry of Health of Uganda. So it is now the duty of the Pharmacy Board of the Ministry of Health of Uganda to now register all those that passed the exam set by the examination committee of the Pharmaceutical Society of Uganda. At that point, then you are a pharmacist. Personally, I'm a qualified and registered pharmacist in Uganda with a registration number of 749. 749 is my registration number. And it is very unlikely that any other pharmacist in Uganda will have that registration number of 749. So I know by this time now, you know how to become a pharmacist in Uganda. Because we are in the COVID-19 times, remember, wash your hands as frequently as possible over a period of 20 seconds, that is recommended. Avoid touching the mouth, the nose and the eyes because you don't know when your hands are contaminated. And as much as possible, if there is no reason to leave home, please stay at home. But also, if you visited this channel for your very first time, remember to subscribe now. Thank you very much for watching. Bye.